Septic arthritis in a child. A 3-year-old boy is brought to the emergency department with acute onset of fever, refusal to bear weight on his left leg, and swelling of the knee. He has no history of trauma. Physical exam reveals a warm, erythematous, and tender knee joint with limited range of motion. Laboratory findings show WBC, 16,000 mm Cochard, ESR 65 mm per hour, and CRP 8.2 mg Gerili. Joint aspiration reveals purulent synovial fluid with WBC 50,000 mm. What is the most likely causative organism? A. Staphylococcus aureus, B. Streptococcus pyogenes, C. Kingella kingae, D. Neisseria gonorrhoeae. Correct answer, Staphylococcus. Explanation: most common cause of septic arthritis in children. Staphylococcus aureus. Other possible pathogens: Kingella kingae, common in children 4 years. Streptococcus pyogenes, gas, less common. Neisseria gonorrhoeae, common in sexually active adolescents. Diagnosis: synovial fluid analysis, WBC 50,000 mm, low glucose, high protein. Blood cultures and synovial fluid cultures. Ultrasound detects joint effusion. Treatment: empiric IV antibiotics, vancomycin, covers MRSA. Ceftriaxone if concern for Kingella in young children. Urgent joint drainage to prevent cartilage damage. Question 2. Kawasaki disease. A 2-year-old boy is brought to the clinic with 5 days of fever and bilateral conjunctivitis. His parents report that he has red, cracked lips and a strawberry tongue. Exam reveals a diffuse maculopapular rash, erythematous palms and soles with swelling, and cervical lymphadenopathy, 1.5 centimeters. What is the most serious potential complication of this disease? A. Rheumatic fever. B. Coronary artery aneurysm. C. Pericarditis. D. Infective endocarditis. Correct answer, B. Coronary artery aneurysm. Explanation: Kawasaki disease, KD, is a vasculitis that primarily affects children 5 years old. Diagnostic criteria: crash and burn. C. Conjunctivitis, bilateral, non-exudative. R. Rash, polymorphous. A. Adenopathy, cervical lymph node 1.5 centimeters, strawberry tongue, mucositis. H. Hands and feet, erythema, edema, desquamation. Burn equals fever 5 days. Most serious complication: coronary artery aneurysm, risk of myocardial infarction in children. Diagnosis: echocardiogram, monitor for coronary artery involvement. Labs: elevated CRP, ESR, thrombocytosis. Treatment: IV immunoglobulin IVIG plus high-dose aspirin. Repeat echocardiogram in 2 to 6 weeks to assess for aneurysm. Would you like more pediatric infection